Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I am pleased to introduce the National Coalition of 100 Black Women, Inc., National President Elizabeth A. Jones.
Good evening. It is my pleasure to bring greetings on behalf of the National Directorate and members that comprise the National Coalition of 100 Black Women Incorporated. NCBW is a 40-year-old advocacy organization with a network of 62 nonpartisan and nonprofit chapters across our nation that advocate on behalf of Black women and girls to promote leadership development and gender equity. Our target areas are health, education, and economic development. We engage with and advocate within political, economic, and social institutions to accomplish our mission and goals. Thank you for tuning in to the NCBW COVID-19 Public Education Series webinar. This evening, we will explore COVID-19 pandemic continues to reshape work in America. We are grateful for the continued support of our sponsor, the Department of Health and Human Services, and our partners, the Black Coalition Against COVID, the Black Women's Agenda, Walgreens, and We Can Do This for making tonight's webinar possible. Now it is my pleasure to introduce NCBW's National Vice President of Programs, Mrs. Minnie Miller. She has served NCBW at both the local and national level for over 25 years. Mrs. Miller.
Thank you, Madam President Jones. It is my pleasure to introduce our facilitator for the National Coalition of 100 Black Women Incorporated COVID-19 Public Education Series, Dr. Reed Tuckson. Dr. Tuckson is a physician who has, among many leadership opportunities, served as the Commissioner of Public Health for Washington, D.C., and President of the Charles R. Drew University of Medicine and Science, one of the 4 historically Black academic medical centers. He is also a co-founder of the Black Coalition Against COVID. Immediately following this short video, remember when Monday mornings were like this? You will hear from Dr. Reed Tuckson, our moderator.
Remember when Monday mornings were like this? They're a bit different now.
Well, it looks like we may have had a little problem with that video, but at the end of the day, it is a different environment now, isn't it? And we are in a different place as we think about the relationship between what we do and the work we do and where and how we do it. And that's exactly what we're going to talk about this evening. It is an extraordinary pleasure to serve as your facilitator for the NCBW COVID-19 Public Education Series and to bring the resources of the Black Coalition Against COVID to this partnership with the National Coalition of Black Women. The Black Coalition Against COVID represents the combined medical professionalism and community-based experience of grassroots influencers in Washington, D.C., and the 4 Black medical schools, the National Medical Association, the National Black Nurses Association, the Urban League, and blackdoctor.org. Well, to put our conversation in perspective, as of today, 6.5 million people have died worldwide, 1,048,000 in the US alone. On September 5th, 342 people died. September 4th, 373. September 3rd, 425. September 2nd, 412. You do the math. You can see that this pandemic is not over. And we have a responsibility to ourselves, our families, and our communities to be involved in making sure that it doesn't kill any more of us. It's important to know that what's at stake is that we have seen a dramatic drop in life expectancy for the nation and for Black people in particular. And it is important for you to know that life expectancy at birth in 2021 for the Black community was the lowest it's been since 1995. We have suffered, and we're still suffering. It's up to each of us, acting individually and collectively, to save our lives and those of our communities. And now we're in this endemic stage where we're having to learn to live with COVID for the long run. We're also in an environment where there aren't the kinds of strict guidance and rules that we were used to even 6 months or 2 years ago. There's been a lessening of masks and other mandates. And so in many ways, we're on our own pretty much now. And so we've got to figure out how we will navigate through this to protect our lives and those whom we care about. The issue tonight is, how will the workplace respond? How will it change, or will it? How do we protect ourselves and our families in this time of uncertainty? Well, we have a great panel tonight, and let me introduce them. Helen Darling is the strategic advisor on health benefits and former president and CEO of the Business Group on Health. She is by far the leading expert in this country on how major employers think about health and health benefits. Jewel Jones is executive vice president for health equity and justice at the media and marketing company called Real Chemistry. And Jewel is an extraordinary innovative thinker when it comes to how do we address the Black community in ways that will help us to save our lives from COVID and other illnesses. My friend Shauna Peaks is one of the co-founders of the Black Coalition Against COVID and an executive board member of the Coalition of Black Trade Unionists, and also very germane to this conversation, just as Jewel is, the mother of young children. And I'm also very pleased that a friend of all of the women in the audience is here, Kim Jeffries Leonard, the 17th national president of the Links Incorporated and an honorary member of NCBW nationally. Thank you all for joining us. And let me turn to you first, Ms. Darling, to help us to set the stage for COVID's impact on corporate America. We'll eventually come to small business and government workplace environments. But from the corporate environment, with this career's worth of insight that you have, help us to understand what motivates the large employers as they start to think about the health and healthcare costs of their employees in the midst of this pandemic that is now moving to being endemic, where we're learning to live with it as a matter of our lives.
Well, you've really laid out what's happened, and what the employers have to do now, and they know it, is they need to support their employees and their dependents in every way possible to minimize the effects of COVID on them and on their families and on the workplace and on society. I mean, we've seen what's happened when devastating illness and diseases affect an entire world. And, you know, none of us at any age could imagine what has happened. And as the picture laid out, and as others and you have said, I know, you know, we've been changed forever. We will never be the same. And so employers are thinking now in a way, I think they've always felt this, but it was more aspirational and the right thing to do. Now they see it is directly in their interest to work to ensure the health and well-being of their employees and their dependents. And it's in their, to use the commercial term, in their vested interest. It's not just nice to do. And I think this has sort of taught everybody a painful lesson. They also want to be sure that their workplaces and everything they do that they have any influence on with their employees and dependents are safe, and that no one is threatened by going into work or working with customers, that sort of thing. So there's just so much that they have to pay attention to now in a way that they always did in some ways, but there's just been nothing like this. They also need to make sure that their employees and dependents have trusted sources for information. Because as you said, Reed, the information changes a lot. Even the best information changes. Science changes. That's what science is about. So we're going to change. What you want to do is have organizations and people, as some of those on this panel are, who work to ensure that they're trusted sources and that they stay on top of the changes, so that when you don't know, is it time for another variant? Well, you get the information from places you trust. And it's up to employers to be sure that the information, we know that, interestingly, and when we found this out a few years ago, we were pleasantly surprised that employees, when asked, what are the sources that you pay attention to? And they actually say their employers. And in many instances, I think, especially where they're labor unions, it's really with the union partners, with the stewards, that you want to be sure that they're the people that people trust in the organization and in their homes, that are the sources of what can be done and should be done. And that we drive disease prevention and health promotion and wellness, and we pay attention to mental health, stress. I mean, I had to laugh, the film, the commuter film, and not only do we have the commute that's a disaster in some ways, never mind places where you work, but, frankly, even the greatest homes, stress is in the home too. When you're going back and forth, I mean, it's a lucky person that it's all easygoing in either one of the two places, but most of us, it isn't. There's different stresses. So
we'll talk about the home for sure.
Sure.
One of the things that I want, Helen, you to also, though, really pick your brain on is that one of the most important things, of course, that defines the relationship between the employer and the employee is healthcare costs and premiums. And we know that so many of the people in this audience that are listening today have already maxed out on how much more they can pay at either premium, co-pays, or deductibles. What do you think is going to happen? And how concerned do you think employers will be about COVID escalating healthcare costs and then driving up premiums?
Well, there's sort of a short-term cost because we've had people holding back from conditions and maybe elective procedures and things like that. So we know that there's going to be a pent-up demand of some sort. And we also know, of course, that the direct COVID effects. But I think what we will see, we know that costs can actually be controlled when you effectively use evidence-based preventive medicine and the right kinds of services. And you make sure that people aren't using emergency rooms because they're getting the treatment that they should be getting, where it's accessible. So we can do a lot better. And I think this phenomena is helping us to think more about what are the best ways to control costs. It is not to do cost sharing for evidence-based preventive services and screenings. It's not to keep people from getting the drugs that they need that are the best drugs for that condition that are medically necessary and things like that. You're not getting a lot of extra things necessarily. What you're getting is what you need. And then also at the same time promoting safety. I mean, injuries are still a big problem, both out of the home and in the home, and they're very costly. And you have strokes and automobile accidents. I mean, there are a lot of ways to control costs that have nothing to do with money. We would save a lot of money if we did more of the things we know we can do. And the trusted sources can help us know that.
This is great. As I turn to Jill Jones, I would just want to sort of also say, though, Helen, that I do worry about people, especially the increased incidence of long COVID and those kinds of things. And those are going to be racking up costs that are coming out of the pocketbook of people. And so, folks, if you ever needed another reason why we want you to get vaccinated and do all the things you're supposed to do, it's because you don't want to be one of those people shelling out all that money for months and months and months on the diseases that you could have prevented. Jewel Jones, you have a number of your clients are in corporate America, and you're talking to them all the time. What's going on with the people that you interact with?
Sure. So, as mentioned, I work for kind of a consultancy, a healthcare focused consultancy that really focuses in on marketing and communications. And I think that what we're seeing every day in action is exactly what's being reported out, right, in our research. And we're really about following the data. So earlier this year, a Pew study found that 60% of workers with jobs that can be done from home say that when the coronavirus outbreak is over, and if they have a choice, they'd like to work from home all or most of the time. That's actually up from 2020, 2 years ago, when just 54% of people said that. And as this conversation around returning to work has continued to evolve, there's been kind of an elevated discussion, right, around people of color and our perspectives on returning to work. So one study that I found really interesting that was mentioned in Harvard Business Review this summer basically said what we already know, right? That only 3% of Black knowledge workers wanted to return full-time on-site to work, as opposed to 21% of their white peers. And another study, a similar study, found that Black, Asian, Latinx knowledge workers, what I guess we used to call white collar, right? Now we call them knowledge workers, us, are preferring this hybrid or fully remote work at higher rates than whites do. And this is why flexibility is going to remain a critical aspect of how we do work post-COVID, right? Or in a new world environment. And so at the end of the day, especially companies like us at Real Chemistry, we're always going to follow the data. All of us have to, right? Employers, leaders, we have to follow the data. We have to be flexible and nimble about what the needs are and keeping the health and safety of our employees and our colleagues and our clients and the communities that we serve at the core of what we do. And an example of what that looks like even within Real Chemistry. And as you mentioned, Reed, I'm a mom, I'm a mother, in addition to the work that I do every day. Like many of us, I wear about 17 hats. And one of, I guess, the best hat that I wear is that I'm a mother of 2 toddlers, a 2-year-old and a 4-year-old. So if you are praying people, pray for us, because they keep us quite busy. But I joined Real Chemistry at 6.5 months pregnant. And one of the things that really intrigued me about this company is that they had, and Real Chemistry is very progressive on our policies, which is why I wanted to use this as an example. When I joined Real Chemistry, we had a preemie policy, a policy in place for parents who, if you have a child born before 37 weeks, you get an additional week off for every single week that your child is born early. That is why a company like Real Chemistry was ready to pivot and be flexible when COVID came around. I joined the company in February of 2020. I was in the office in DC for 2 weeks. And then we moved to fully remote, but that was a seamless experience because flexibility was built into the way that we work. And so I think that is just the new reality of where we are. But at the same time, we know that all workplaces are not that way, right? Which is why we have to focus on equity and justice. So initiatives like the Fair Work Initiative by the Black Women's Health Imperative, the work that NCBW does in so many organizations, making sure that these experiences aren't just for those of us who fall into the category of knowledge workers, but that everyone who as an employer really kind of acts at the core of, what is your right and responsibility to do right and well on behalf of the people who keep our organizations running. And I think that that's just going to be what the future of work looks like in the US.
I'm going to turn to Kim in a minute, but could you just repeat what you mentioned? Like, was it a bill, a law, or an act?
Yeah.
What was that?
Sure. So the Black Women's Health Imperative has an initiative called the Fair Work Initiative that really focuses on how that science has shown that chronic stress, right, and working in racist, discriminatory environments, and how that puts us at risk. It's acknowledging what a lot of us, these conversations around quiet quitting. I'm like, Black women have been loud quitting since the beginning of time. We don't have an option, right? We have to. It's not just about setting boundaries in the workplace. It's what we have to do every day, but we have to make sure that we center our whole health because our families, our communities rely on us. And so that the Fair Work Initiative is really focusing on how they are advocating for better work environments, specifically as we think about the implications of a Black woman's health on how we operate in the world around us.
Thank you. Kim Jeffries Leonard, you have had a lot of different roles, and one of them is you've been very intimately involved in advising and supporting local government in Washington, D.C., as well as small businesses. How do you sort of see it through your prism?
Thank you so much, Rita. You know, there's I think that what Jules said, there's a lot to unpack there. I'm really excited to be here. Really also be glad as I'm honorary member for NCBW. But one of the things that I will say is that the data that Jules presented, there's additional data. Black folks really don't want to go back to work. They have shown that they can do this work remotely, and we've had to do it. And some of it is health related, but some of it is also around what she said about having to deal with those microaggressions that are steeped in racism. Black women, Black folks, we're the ones who are going to be at in the space where when employees say you got to come, we don't always have that flexibility. When you talk about Black women who are having to deal with our children, you know, the schools are doing very different things. And what you're seeing is that we're starting to take away those tools that keep us safe. So when you talk about masks, just today, New York has lifted their mask mandate for transportation. How do you get to work? We just saw the video. I'm sure that was New York with folks getting on the subway. You see how close people are together. When you take away those tools that are going to keep us safe, and you don't require people to put on a mask. You know, every time we get on an airplane, we see, you know, 90%, I think I'm the only person on an airplane with a mask on. but these are the things that do keep us safe. When you talk about Black women having to go to work, you know, a lot of times we have different generational in our homes. We've got to keep our older parents safe. We've got, you know, we're in the sandwich generation. We've got to keep our children safe. Vaccinations and boosters are at a very low rate. I do serve as the chair of the Commission on African American Affairs for the District of Columbia. Our mayor tried to put policies in place to keep her workforce safe, her government workforce safe. She tried to mandate that members who of the government, the District of Columbia government, they had to be vaccinated. She was sued by one of the unions, and the judge said, no, you can't mandate that. And so if I'm working in close proximity with some of in some of these fields, I can't be sure everybody is vaccinated. I can't be sure everybody is boosted because it's not something that's mandated now. She can't legally do that. And so every time I come into contact with a coworker who I don't know what their status is, I'm putting myself at risk. I'm putting my family at risk. And so these are the things that we as Black folks have to deal with when we talk about re-entering the workforce. I think it's amazing to have that kind of flexibility that Jewel talked about. Most of us don't have that. You know, the data shows that, you know, who wants to come back to work? Who wants to be in the office? White men. They want to see you there. They think that you're more productive, even though the data has shown just as productive or even more productive working remotely. And then you have our community who are disproportionately have the jobs that don't allow us to work remotely. And so again, when we start taking away these tools, when guidance changed, you talked about the fact that we really don't have the guidelines anymore that to keep us safe. We have to keep ourselves safe. And that's kind of where the CDC is moving. We're giving you information, use it to keep yourself safe. We're the ones who are exposed to these variants that are even more contagious. And so how does that play out? It's a spiral, it's a vicious cycle. So we, as always, you know, cold, flu, COVID is hitting African-American people of African descent all the time.
And Shauna Peaks, you have a unique perspective on all of this, being a voice of organized Black labor. And I know that you've spent a lot of your energy even trying to advocate on behalf of the essential workers who put their lives on the line for us. How do you see this issue?
So, I mean, as everybody has already said, you know, a lot of people had the option to work from home. And we've represented a lot of essential workers that did not have that option. So it didn't matter if you wanted to come to work or not, you had to be there. We didn't have that option that our employers were allowing us to do the work from home because they couldn't. You know, we had people who needed to be in those grocery stores to be able to provide food for people. We had people who were driving the trash trucks, the sanitation workers who were making sure that your trash was picked up, because without without that, it would have caused a whole nother issue. And there's no way to social distance, even if you wanted to, in certain situations. My regular position is that I'm a civil human rights director with United Mine Workers of America. We represent coal miners. There's no way to be underground and serve in a way that is protective. So we had to pivot. And that's why when Ms. Darling had said about unions, that was one of the beneficial things that we had for our essential workers, because even though the employers and these companies did not want to protect their rights, we fought for their rights. You can't have these people coming to work and you're not providing them with the proper equipment that they need to do their jobs every day. If you're going to have them in there, they need to have the stuff that they need to be able to do their job. And when you put the mental perspective on that as well, dealing with the stress of knowing that you have to go out every day. And then what are you bringing back home to your family, especially the nurses, the doctors, a lot of them, they couldn't go home at all. So it was in terms of how do we pivot to make sure that we're protecting our workers, because they don't have a choice but to go to work. And that's why it's so important to have those protections in those contracts that, hey, I need to be off of work. My mom who lives with me tested positive. I need to make sure that she's okay. I need to make sure that nobody else in my household tests positive. We have to have those protections where you're not being penalized if you have to take off from work from being sick or taking care of somebody else in your household or your family members who are sick.
Helen, we've got a question, and nobody, this is sort of asking to speculate, but do we think that life will ever go back to pre-COVID normal?
No. Is that the question?
Yeah.
No, it won't. No, it isn't, and it never will. And what's interesting about this, just listening to my other three panelists, it varies so much by individual, by the job, and even within a company, the job. So you have essential workers, you have unionized employees, you have executives, and I won't make a joke out of it, but I love it because I laugh when I heard you say about who wants to be back. It's the white men, but it's more likely to be the executives that they want to be back for their own reasons, whatever they are. But the irony is that it's executives who most often aren't in the office because they're out working all sorts of places, and no one doubts that they're working very, very hard. So it's so funny that they've been the ones frequently that were so resistant to understanding some of the things that Jewel talked about. Knowledge workers can work in a lot of different places, and at least they have more flexibility. And it seems to me it might also help us rethink. I mean, what this is forcing us to do is to rethink everything about work and the responsibilities of employers, of owners, of employees of all levels, the responsibilities that we have to each other. And that's probably the biggest difference. Sadly, we hear almost as much bad news as we do good news on that point, but we have all learned, as this whole panel has said, it's what other people are doing or being made to do or not being made to do that are having a huge impact on my loved ones and on me. And that matters a lot in a way. I mean, we had the debate about smoking. We finally sort of got all the smokers out of the building and even out of the parking lots and everything. So our air wasn't polluted by the smokers. And we had a way that if you were a non-smoker, you got a non-smoker discount on your health insurance. So I think we need to go back to the model that says, if you want to insist on doing things your way, which creates downstream both cost and bad health effects on our community, then you're gonna cost us more. You're gonna cost everybody more, and you're gonna have to pay a lot more of it than we are. And that's one way to get around some of the lawsuits and things like that drive us all crazy.
So that's very, very intriguing. I think, and first of all, I'm very glad that you would introduce the history of smoking into this. So we do know that it is possible. It took a long time, but it is possible to change the environment of the workplace to be health responsible. And so I think that's key. Jewel Jones, let me sort of ask you, What advice could you, this is from our audience, what advice could we give employees who work remotely but miss going into the office?
You know, that's such an important question. I find that as we think about what children are losing by not being in a structured learning environment in schools, I think a lot of the same can be said for people who are earlier in stages in their careers, and how much we learn, especially in the knowledge economy, from just being in an environment that's helped you to understand cultural norms and expectations in your workplace. And so I just anecdotally within my organization and from friends and other folks who I speak to, there are people who feel incredibly isolated, right? By not having, everyone has a different home structure. How everyone defines family is different, right? When someone goes home, everyone has a unique experience for what that means. Me in my house, as soon as I hit the door or close the laptop, I've got 2 children, a dog, my husband. We immediately move into dinner. We call grandma, who I lost my father-in-law to COVID in the early days of the pandemic. And so we consider my mother-in-law part of our immediate family, right? And supporting her because she's home alone, right? And so I think it's, you know, everyone has different responsibilities, but I also have people on my team within my friends group who, when they're at home, it's just them, right? So going into the office, having that social connection is something that I think we have to respect and honor. And so what advice do I have? I think it's about speaking up about what your needs are, connecting with people who have similar interests. And so in our office, for instance, in our Washington, D.C. office, we regularly get together and have a happy hour in the office on certain days. And so you know that you're going to see people or more people on a Wednesday. We make sure that we're meeting up to go to baseball games or go to different events together. And I think that forming those communities is important. One other thing is, again, just being flexible. And so, for instance, I think about one of my favorite work colleagues is a friend who doesn't work for the same company as me, but we talk very regularly, a couple times a week at the very least. And it feels like he's part of my virtual office community in a way. And so I think that flexibility and thinking differently about work is going to be key for anyone, especially if they really want to be more present in the workplace, because I just don't see it returning anytime soon to what it was in early 2020 and before.
Kim, you are lucky to be an honorary member of NCBW, so that you would be able to benefit from the collegiality and the engagement of many, many women when you're working from home. But those times when you're working in the office, the mayor, as you mentioned, of your city was unable to have a mask mandate, but you're there with those people working alongside them. What would you expect or want to have in place that would give you the safety of being in the workplace, even though they could not mandate the mask? What are you holding management accountable for?
Well, let me make sure that we're clear. They could not mandate the vaccines. What she was trying to do was ensure that everyone who was in the government workforce, the district government workforce, was vaccinated and boosted. And so everyone had to show proof of vaccination. And it was when they were sued by a union, they stated that they could not do that. Certainly, I think that people should be able to wear masks if that makes them feel comfortable. These variants are very contagious, and they're transmitted in ways that we don't even know. You mentioned long COVID. We don't know who is susceptible and who gets long COVID and why someone gets long COVID, but we do know the effects of long COVID are devastating. So they have economic implications for the employer, economic implications for the employee, economic implications for the family. And so people should be able to feel comfortable spacing themselves out if that is an option. As Shanna said, there's some disciplines, in some workforces, there's no way you can even do that. And so if I can't do that, I should be able to make sure that I'm, that I am able to put my mask on, and that there's no shame in that. We've seen some of this stuff become very politicized, and we've seen different jurisdictions saying we're not having masks. How do we politicize things that keep us healthy? And so what I would like to be able to see is that if this makes me comfortable, if I want to be spaced, if I can, if I have the flexibility of coming in when on a day when there are few people, then I should be able to do that, because that only serves to ensure that I'm going to be productive, ensure that I'm going to be able to keep working. Because even though the guidelines are starting to change around quarantine, at some point you are going to have to step away and miss some type of work if you contract COVID. I know people are saying everybody's going to probably get it. And that may be true. But what happens when you get it? We still don't know who is more susceptible. And so the goal should be to keep everyone as safe as possible and to try to make sure that none of us get it.
And Dr. Leonard,
go ahead, I'm sorry.
Oh, no, I was just going to add to a point you made about how people can set boundaries about what's comfortable for them in the workplace so they feel confident going back in if and when they choose to, right? If they can choose. One thing that I've seen that I think is really interesting is like the armbands where people can choose, and it says something like, if your armband is red, it's like, please stay 6 feet away. If it's yellow, I'm okay with a elbow bump, and something like that, so that it helps people to feel less social pressure around showing up in the workplace just based on what the most senior person is doing. They can kind of set their boundaries in a way that helps people to understand how to engage them in the space based on what they're comfortable with, based on their personal preferences around health and safety.
I've been actually in that environment. I'm sorry, Kim, please.
One of the things that I was going to say is that we also have to start to retrain ourselves. As Black women, we feel like if I put a red armband on, what is that really going to say about me? That I don't want to be touched. I don't want you to touch me. But in reality, you really want somebody to stay away. So we have to start working on ourselves to say, and this goes back to the mental health piece that Helen was talking about, and the mental wellness. It's okay to set boundaries. It's okay to say, I don't want you this close because of whatever. We don't even have to explain why. I just don't want you this close. And so this is almost a retraining for ourselves to be able to say, it's okay to ask for that red armband. It's okay to ask for the.
Actually, I'm going to come back to Shauna in just 1 second, but Helen, you and I were at a meeting not long ago where just that very thing was done. How did, and again, this idea that you would have a badge or you put on your name tag and you have a sticker with different colors and it would say, stay away, or I'm a hugger, it's okay. How did you react to that, Helen?
Well, anything that's new, there's always a little bit, things don't quite work the way they should. But I think you mostly are perplexed. You don't quite know what, it's more you're perplexed. This whole discussion that was is reminding me of something extremely important, and which is everything really goes back to the culture of an organization. Every organization, whether they want it or not, has a culture, and it's a wide range of topics. But this is an example. If, for example, as Shannon was talking about, you've got people who have to come to work, they are at risk. The good culture would say, because our employees don't have a choice, these are the things we need to be doing with them, and working with the union to make sure that they're getting proper protections, that they have, the time off that they need, that extra efforts are made to make accessible for them and easy at no cost vaccinations. If you can't mandate it, make it so easy, and get people who are leaders in the organization and in trusted organizations. So nobody's saying you have to have it, but you want to have it. Just like there was a time when a lot of people quit smoking, not because it was mandated, but because they were being heard from doctors mostly, and scientists, that this stuff is killing you. And so it's slower than mandates. In this country, it tends to be faster, if only because a mandate usually gets a lawsuit of some sort, and then we're off on a different path. But we can make certain that the culture, and I thought, I can't remember, it was Kimberly or Jewel that said about the microaggressions. You know, if your culture is a place that people feel, if they're introverted, they're uncomfortable, if they are experiencing disrespect or microaggressions or whatever it is, there's something wrong. We need to fix that anyway as a culture of an organization, because even for the people who go in, there's something wrong when those things are happening. And the organization needs to be working on those. So maybe we need a chief officer whose job it is to help the transformation, do all the things that should be done and that are hurting everybody in different ways, depending on the organization.
Shauna, what do you think about that? And in addition to that, when you, as you start to interact with employers and you all are fighting to protect the health and safety of your workers, what are you expecting the employer to do?
We're expecting the employer to protect their employees. You know, that's what makes sense. But of course, we know that that doesn't necessarily always work out that way. You know, a lot of times you have to be your biggest advocate, you know, especially as Black women, and in dealing with in ways that we, you know, some doctors who may not look like us don't think that our pain level is what it's, you know, they don't feel any pain. You have to be your own advocate. And that's what it does when you're in a collective and you're able to not just speak on your behalf, but on your behalf of everybody. And so when you come together collectively like that and express your concerns, because if this is your livelihood, this is what is helping you to take care of your family and provide for your family and yourself as well. You have to be able to have those seats at the tables with your employers to let them know, hey, I understand that you may not be able to do this and this and that, but it is very imperative for us to be able to do our job for you, that we have these certain protections and these certain provisions put in place. And, you know, most employers, they will try to work with you. A lot of them will, but then you have those who just think that you're another number. And so that's when it's imperative to have those contracts and have those venues where you can fight for your rights and know that, hey, okay, so if we need to file agreements, we'll file agreements. If we need to, it's certain provisions in place to help to protect you so that you know that when you're going to work, you're going to a place where you're, one, as safe as you possibly can be, and that you are able to get the benefits and things that you need to be able to do your job effectively.
I'm going to come back to all of you around the notion of how do we start to better educate the workforce and Black women in particular to protect themselves and advocate for their rights. But before we do, we're going to take a quick time out and respond to some of the questions that we've got in the chat. And first of all, someone wants to know whether or not, if you've already taken, and I'll answer this one, I guess, as the physician on the panel, if we have already taken a booster shot this year, should we still get the new fall booster shot? And the answer is absolutely yes, 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 yes. Be early in line for it, because we know that it has been approved. We know that it is safe. We know that it is effective. And we know that we've got these various new strains of the virus. The good news about the new vaccine is that it's something called bivalent, which means two. It has protection for the old strain and the new. And so you really do want to take great advantage of that. Someone also wants to know, do we still think they will be producing new boosters for COVID in the coming years? And unfortunately, one of the elements about being an endemic, E-N-D, instead of pandemic, but E-N-demic, is that we will be living with this almost like we are living with the flu. And so I think that we can expect that this virus will continue to hang around. It's going to hang around because we didn't kill it off at the early stages because of all the ill-advised people running the federal government and ill-advised people running state governments and a bunch of conspiracy knuckleheads, but I ain't mad. But because we didn't kill it off at the beginning, now this thing will stay around and will mutate and change, which is what viruses do. And so we will be having new vaccines, I am sure, for many years to come, and we're going to have to learn to get used to that. By the way, they also say, do we think, let's just one more here, do employees still need to wear masks at work if everyone is vaccinated? And again, it depends on the rate of transmission in the community in which you live. One of the things that we are urging everyone to do is to go and look at your local health department data and see what the trends are. If the virus is very prevalent, very available in your community, you'll want to be much more cautious than if it was not. And of course, it depends on whether you have a pre-existing health condition that puts you at risk. And then, as Shauna has indicated, whether or not you have people in the home that you're returning to who you could infect and they would be at risk. And so we would want you to be very cautious there. And Kim, you have an answer on that as well.
I just want to say one additional thing. Being vaccinated doesn't keep us from getting COVID. What it does is it keeps us from being severely, well, some of us, most of us, from being severely sick from COVID. I think that's the difference between early in the pandemic and now, when you're starting to see less hospitalizations. And so wearing a mask is one of the tools. And I know I'm the big mask person. They talk about me really badly. But wearing the mask is really one of the tools that help keep me from transmitting it to you in case I got it, and you from transmitting it to me in case you have it. And so I just want to make sure that we're clear. Getting vaccinated doesn't keep you from getting COVID.
And let's, the two big points here, and then I'm going to turn to Jewel around education in a moment. But I think that the ethical, moral obligation that is in Kim's comment, my mask keeps me not only from getting it from you, but it keeps me from giving it to you. We can't walk around and say that Black Lives Matter if they don't matter to us first. And I don't understand, I will never be able to understand looking at somebody with a Black Lives Matter sign and they're not wearing their mask when they're at risk and they're not vaccinated. That just is hard for me to do the math on that. We've got to decide that Black life is more important than the slogans. We got to act like it. Joel, how do we start to communicate with our fellow employees about the importance of taking precautions, about being vaccinated, about getting your booster, and about if you are sick, not coming to work? How do you talk to people to get them to be more responsible in their behavior?
So that's a great question. I think there have been so many campaigns and initiatives, especially over the last couple of years, right, that really have been focusing on employee education around COVID, how to take precautions, how to stay safe, and how to keep other people safe, right? And I think, as we've learned from other kind of public health crises, the repetition of message, as soon as we're getting tired of it, it's just starting to resonate with other people. We have to keep that in the back of our minds, right? And also making sure that we tailor the message to what the concerns are of our employees, right? And that might differ by population based on where someone lives, the social determinants, right? So we have to leverage the data and the insights that have really guided us through other issues in the past and make sure that we're not just trying to create a new wheel, right? But we're taking the learnings and applying them to what works, and then leveraging the data, inclusive data, to tell us how to amend our approach, right? And these days, and I could get really nerdy about this, but I won't, we have so much rich data around and so many rich ways to find out how folks are thinking about certain issues, what they believe, what they're feeling, what moves them, what triggers them, what turns them, what shuts their ears off from hearing a message. And we have to remember that this is not a flash in the pan, this is the long game. And so again, making sure that we stay consistent in engaging in the messages that are driving change and people are receptive to, listening to them and what their needs are, because people will tell you what they need and what they want if you're listening. and if we respond in that way, then we'll be successful.
Let me ask you to take off the nerd hat for a minute and put on your sister hat. Real talk.
Oh, well, I'm always wearing my sister hat now. That never comes off.
When you're talking to your sisters about these issues, what's the conversation like? Is everybody on board, or are there still a lot of people that are not on board? And how do you all deal with that?
Well, first off, I can't speak on behalf of all the Black women in the world, but because we're not a monolith. But I can tell you that within my community, we're we over me people, right? Like, we center the needs of our beloved community even over ourselves, which is why we need to sometimes set better boundaries. To make sure that we're taking care of our health and that we have enough energy to take care and support other folks. But I think that what I have seen in the conversations that I've had with my friends, of course, we're all, for the most part, on the same page, overwhelmingly on the same page, that it's about keeping ourselves safe, keeping our families safe. And we're the annoying people, for the most part, in our groups and our communities, telling folks, I know you're tired of hearing this message, but put that mask on in my house. No, we're not having get-togethers in my house. We can meet outside. I'd love to entertain you in the backyard. But yeah, so those are some of the things that we're doing, but overwhelmingly we are all on the same page.
Kim, real talk. Kim, real talk, when you're with your sisters.
Well, like I said, everybody knows, she's not taking her mask off. If she's not eating, she'll come to the restaurant, but she's not going to eat. She's going to sit there with her mask off while the rest of us eat. But I agree with Jewel. Most of us, we really want to do the right thing. We really want to keep each other safe. We really want to keep our community safe. It's been a long time. We have been in this for a very long time. People are tired. People want to get back to normal, whatever that looks like. And so, people are happy to get a vaccination, and that if that means I can go out and hang out and do what I'm used to doing, then I'm going to go get my vaccination. I'm going to get my booster. But it is those extra steps. It is, I think that, we're probably the last of the, no, you're not coming in the house. Yeah, you need to put a mask on. I mean, even, there'll be times where people say, oh, you want me to put a mask on? Yeah, of course. I don't know where you've been. But I who you've been around, and you don't know who you've been around because you don't know who they've been exposed to. So I think the problem is, the challenge is, there's no problem. The challenge is the fact that people are weary of being in this pandemic that is now an endemic. And how do we live with this when you've been telling me to get a vaccination and that's what I did, and now you're telling me I got to keep my mask on when I really just want to see your face, and I really just want to be able to hug you, and I really want to be able to just sit down and have a meal and stop all of this. That's why you see so many organizations coming back together and being out and open, because people are tired. And so we have to understand that people are tired, but the conversation doesn't change. Because, the goal is the same. We want to keep each other safe. We want to keep ourselves safe. We want to keep our community safe. But it does take a little more because we've been here for such a long time.
I want to turn to Shauna real quick and give you a chance for real talk and what it's like when you're with your sisters. And then give everybody fair warning that, starting with Helen, I'm going to ask everyone to give me 20 seconds as we close out on what's the one thing you either want to double down on before we end, or something you didn't say and you will kick yourself because you didn't say it. But Shauna, real talk, what's it like with your sisters and what do you say to them?
Well, my nickname is the COVID lady, so I have accepted that term. But the same thing, I just feel like as our job, I have to make sure my house is good first before I go out into the world. So, and we're not always aware of what our family knows, especially like around voting rights and things. I'm like, did you vote? And they're like, what you mean? I'm like, you're supposed to be voting, so if I can't get my own family to do what they're supposed to do, how am I going to go out in the community and do it? So I make sure, that any new information, anything that's going on, I'm making sure that I'm letting people know. And yes, also keeping them safe. If I have to lead by example, I have to do it. I'm wearing the mask, and it may not be the popular thing to do, but at the end of the day, if that's what I can do to protect you, then that's what I'm going to do.
10 seconds, everybody. Helen.
So I would just repeat the importance of vaccinations and annual ones and accepting it based on the endemic. I do think I respect everything that's said about masks and all that. I do think that it's going to be harder and harder if it isn't already. So we have to get people at least to understand that they really are hurting themselves and others if they don't get vaccinated as soon as possible.
Thank you. Jewel.
So I'm going to take it a bit in a different direction, especially given where the
20
platform
seconds.
that we're on today. I'm going to say that we need to continue to listen to Black women. We have incredible insights about what we need for our community, what our communities need, what our workplaces need, and making sure that we're centering our voices in the solution and not just the challenges, I think is critical to getting through this and many things.
Kim Jeffries Leonard.
Vaccinations, boosters, and keep that mask on. We can do it.
Donna.
I'm gonna take one of your lines. This ain't over. So just continue to educate yourself and know that we're gonna be dealing with this for a time to come. So you need to make sure that you are listening to the professionals, you're listening to the people who know what's going on, and stay wearing your mask and get vaccinated.
And I will say, as a Black man, the most important thing is for Black men to listen to Black women. With that, thank you all very much. You've been wonderful. And we turn it back to our dear friend, First Vice President Minnie Miller.
And a special thanks to our panelists, Ms. Helen Darling, Ms. Jewel Jones, Ms. Shauna Peaks, and Dr. Kimberly Jeffries Leonard for providing that much needed information on COVID-19 pandemic continues to reshape work in America. We would also like to thank our sponsors, United States Department of Health and Human Services, the Black Coalition Against COVID, Walgreens, and the Black Women's Agenda Incorporated. Our special thanks goes to our National President, Elizabeth A. Jones, the National Directorate, staff, the National Health Committee, and our producer, Bridgette Baker. We want to hear from you. Please take a few minutes to complete a quick survey about tonight's webinar. You can either scan the QR code on the screen or use the link that we've dropped in the chat. Your feedback helps us to continue bringing programming like this one to the community. We appreciate each of you participating this evening, and we believe that you are better informed on how COVID-19 continues to reshape work in America. We invite you to register and participate in our last webinar on the COVID-19 education series. Enjoy your evening.